The Canadian Constitution Foundation, or CCF, is an independent, nonpartisan organization that defends constitutional freedoms in both the court of law and public opinion. The organization takes on many different cases, ranging from unconstitutional liquor laws, which the CCF recently gained a big win on, to property rights laws involving firearms and civil forfeiture, which I've attached links to in the text portion of this story for more details, if you're interested. Here, staff lawyer Derek Frum explains another important case that the CCF is currently working on.
Another one of our high-profile cases is ongoing and has yet to go to trial, and it's in BC. It's the Canby Clinics trial, where we are trying to vindicate patients' rights in BC, because patients all throughout Canada, and in BC in particular, are languishing and dying on wait lists as they await to get necessary medical attention.
I've talked a lot about the bloated Alberta healthcare system and some of the issues that have come up, including ridiculous wait times, and it looks like it's the same in BC. Check out these wait time stats from the Fraser Institute. The average wait time in BC from general practitioner to specialist to actual treatment is 22.4 weeks. In some cases, this could mean serious implications, like progression of diseases that come along with medical complications, or even death. And I'm not even exaggerating. In the case of 18-year-old Waleed Kalfala, he was confined to a wheelchair after waiting 27 weeks for healthcare and surgery for a progressive spine deformity. And there are countless other stories just like his. Fortunately, we have places like the Canadian Constitution Foundation that fight for our freedoms, which Derek explains a little bit more about here.
Governments will always seek to grow. That's just the nature of government. And the Canadian Constitution Foundation, we take a look at what the rights of individuals are when those rights have been taken by an overreaching government or violated by an overreaching government. The fight is ongoing. It's a never-ending fight, and it takes an organization like the Canadian Constitution Foundation to stand up and defend individuals against governments that have nearly unlimited resources. And where we step in is that we fill in that gap and we provide our services pro bono to individuals who are unable to defend their own rights against very, very litigious governments.
The aim of the Canadian Constitution Foundation in the case of the BC healthcare policy is to give patients more control over their healthcare options by challenging sections of the BC Medicare Protection Act that prevent patients from obtaining private medical care in a timely manner. Most countries do actually have a mixed healthcare system in which patients can either seek medical advice and treatment from government-mandated systems or private facilities. And in all reality, why should Canadians that have the ability to access a privatized healthcare option have to wait in a lineup to die? For TheRebel.media, I'm Holly Nicholas.
Thanks for watching. Click here to never miss a Rebel update. Want even more of The Rebel? Well, click here to become a premium member.